Hi, my name's Dr. Kerry Tapuzian, and you're watching Ask Dr. T.
Hi, I'm Dr. Kerry Tapuzian, and you're watching Ask Dr. T.
Hi, I'm Dr. Kerry Tapuzian, and you're watching Ask Dr. T.
No, I'm Dr. Kerry Tapuzian, and now you're watching Ask Dr. T. Today's question is, what can you tell me about pandas or PANS? Now, we're not talking about the cute little animal. We're talking about a condition that happens with kids before puberty. Pandas stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcus Infection. That's a mouthful. PANS stands for Pediatric Autoimmune Neuropsychiatric Syndrome because this condition can present in different ways with different symptoms. The hallmark symptom, or the symptom that is most common, is a sudden onset of OCD in a child. Okay, and this usually follows some type of infection. So this is a, if you will, a neuropsychiatric condition that is from an infection and should be treated as such. Unfortunately, a lot of physicians aren't familiar with this disease entity because it's fairly new. As a matter of fact, there's not even a diagnostic code that physicians can bill for yet because it hasn't been completely recognized. But there's plenty of literature out there on it, and a lot of children will get treated with antipsychotic or antidepressant medications with minimal success, and that's because they're not treating it correctly. It needs to be treated as an autoimmune infectious disease. The area of the brain, if you're interested, is called the basal ganglia that's affected, and it's an autoimmune reaction. Some of the other symptoms that may be associated with the OCD are tics, ADHD, separation anxiety, bedwetting, difficulty reading. Your kid just all of a sudden just isn't able to read. It's just really difficult. Mood changes, including violent behavior, rage, change in handwriting, joint pain. These are all conditions. If you're unlucky, your child may have all of these symptoms, or they may just have one or two of them. Again, the cause of this is infectious, and the three most common bugs that will cause this are strep infections, mycoplasma, which is another type of bacteria, and Coxsackie virus. These three things should be tested for by your physician or pediatrician if your child is having a sudden onset of any of these. And usually it happens after the child has had some type of flu-like syndrome or infectious process, fever, etc. So treatment of this condition is with antibiotics, and unfortunately long-term treatment of antibiotics. In many cases, the child has to be treated until they're out of puberty, or else the symptoms return. There are some other treatments as well. Non-steroidal anti-inflammatory medications like Motrin, ibuprofen, when given initially, will be very helpful in the controlling of these symptoms. And ibuprofen is anti-inflammatory. In some cases, IVIG is utilized, which is intravenous immunoglobulin. This is something you can look up and talk to your physician about. There are also some different types of therapies that can be performed, including cognitive behavioral therapy, which is something you can look up, CBT. There's also another treatment called ACT, which is acceptance commitment therapy, which if you go on the internet, you should be able to find a practitioner that can treat your child using this also. There are also some additional non-toxic, holistic therapies that you could also consider with the treatment of pandas or PANS. They would include using a high dose of cod liver oil, which is anti-inflammatory. You could also try a gluten-free, dairy-free diet for 2 to 4 weeks, see if there's an improvement of your child's symptoms, because this, in essence, is a anti-inflammatory diet. High doses of vitamin D for about 5 days may or may not be helpful. High doses would be somewhere around 20 to 50,000 international units for about 5 days, and then lowering the dose significantly, maybe going down to about 5,000 IUs per day. Remember, vitamin D can accumulate in your body, so you don't want to be at a high dose for a very long period of time. Again, any supplement that is anti-inflammatory may be beneficial and helpful in this situation. There is another medication that can be compounded at your local compounding pharmacy. It's called naltrexone. Low-dose naltrexone has been shown to modulate the immune system, increase endorphins, increase your natural killer cells. So the benefit of this is that it may help with fighting the infection that your child has, and it also may help with these symptoms. Well, in a nutshell, that's a description of what Pandas is and the treatment and the causes. Are there any questions out there? Oh my God, there's a lot of questions out there. Well, I'll tell you what, if you do have a question, you can email me at askdrt@gmail.com. You can also go to my website at www.ask4drt.com. And of course, as a side note, if you're interested in historical fiction and novels, there's a great book. It's called A Perfect Armenian. You can find out more about it at www.aperfectarmenian.com. My name's Dr. Kerry Topouzian, and you've been watching another episode of Ask Dr. T. Take care.